It's not race that causes disparities, it's not being queer that causes disparities, it's racism, and it's transphobia, and it's homophobia. I'm trying to solve things with interventions that are systemic. My name is Mandi, or Dr. Pratt-Chapman. I am a cancer researcher that focuses on social needs for cancer patients and access to care challenges. I would say my primary motivation in the cancer space has been my grandmother, my Nana, who was my dad's mom. She had breast cancer twice, and the only reason I knew that was because when I came to visit her in the summer one year, she only had one breast. And then when I came several years later, she didn't have either breast. For the last 2 weeks of her life, the majority of those 2 weeks were rotating my grandmother and going to a store to try to find a pillow that would reduce the bed sores. Being able to connect with her on a level that wasn't selfish, that wasn't about her serving me. Because I think ultimately that is what drives everything that I do, is that I care about connection. The cost of precision medicine is huge, literally $10,000 or $20,000 for a treatment that lasts 3 months or 6 months. One of the largest projects I'm working on right now is in collaboration with MedStar and Howard University Cancer Center. The primary goal of the study is really trying to systematize asking patients these questions, like, in the last 2 weeks, have you had any trouble getting food? Have you had trouble with transportation? Have you had to stay at someone else's house, or do you have housing stability? And really what we found was patients wanted to be asked these questions, but it wasn't always happening. And so we're trying to address systemic problems. Even among triple-negative breast cancers, white women with triple-negative breast cancer survive longer than black women with triple-negative breast cancer. So it's not a genetic thing, it's a racism thing. Our whole kind of financial, social, legal, and healthcare system is impacted by the bias that comes with having a 400-year legacy of slavery. If someone is not at the table, if leadership is only white and only male, then you don't have certain perspectives that are important to solve. When you bring a challenge to DC Medicaid, at least in my experience, there's a true wish to solve the problem. When I was doing this mixed method study looking at transgender cancer screening and healthcare experiences, it was a DC specific study, and what I found was that transgender women often had wonderful relationships with their doctors. Transgender men had a totally different experience in my sample. They avoided healthcare unless they were in extreme pain. They were worried about being denied healthcare. They frequently had poor interactions with providers, a ton of gender dysphoria. I mean, people not wanting to get breast screening, not wanting to get cervical screening because these body parts are not ones that they even kind of want to acknowledge. Going into a facility and sitting there as a male with pink all around you can deter you from wanting to go. Inappropriate kind of questions that were driven out of personal curiosity as opposed to clinical curiosity for what was best for the patient. I also just recently founded a nonprofit called INCLUSIVITY, and the goal for that is really to help bridge some of the polarization that I see that is related to healthcare but is beyond that. I strongly believe that really challenging problems can only be solved with a diversity of perspectives, lived experiences, backgrounds, because if you only have the same type of person, you're not seeing all of the things that you need to consider. So I would say to someone who is entering the cancer care system, ask for support and take it. Bring the person or people who make you feel supported to your appointment with you. Have them listen and take notes because you might be overwhelmed. Ask if there's a navigator, ask if there's a social worker, ask if there are support programs. Legacy means to me where I've made an impact on someone's life. When I hear that someone has made a connection with their healthcare team that I've somehow helped facilitate at some stage. If people feel heard and listened to, even if I'm never even in the picture. My dad told me, you are not better than anyone and no one is better than you. Never let anyone make you feel less and don't ever make anyone else feel less. I think my dad kind of laying that foundation of everyone has an equal human worth really drives a lot. It's still somehow about connection. My name is Mandi, and this is my life. This is my legacy.